Assalamu alaikum. Dr. Hussain Bashkolachi YouTube channel is with you, and today we are discussing the health problems of the old age as well as the cost of the care and the irrational use of the medical judgment or health care services where it is not required. Tests and other surgical procedures are not required, particularly for the female patients and those who are in need of antenatal as well as the delivery care. Normally, the cesarean section is done without further investigation or in the haste, and ultimately the surgery is done, and the cost of the normal delivery or the birth increases. Same is true for the uh, charges or the fee for service by general practitioner or by the consultants or by the healthcare providers, big hospitals, tertiary care hospitals, uh, including the latest technology use, MRI, X-ray, as well as the advanced tests from the laboratory. All these are very costly, and ultimately the poor patient is unable to pay the fees as well as charges. Sometimes it is reported that the dead body is in the hospital and the bills are not paid, and even the dead body is not allowed. Same is true for the drugs and spurious drugs, as well as the misuse of the drugs or irrational use of the drugs because of the companies and because of the promotional activities. Doctors are forced to write the drugs so that the sale is increased, and ultimately the people from the pharmaceutical company, they are visiting the doctors and providing them perks, facilities, and even the foreign tours or the uh, they provide to attend conferences in a very advanced countries with luxury foods as well as luxury residential and transport support. So this is one of the dilemma of the present healthcare system, and this system is more concentrated in the posh areas. And nowadays the transplantation, kidney transplantation as well as liver transplantation is also one of the leading service, and the cardiology and emergency services, particularly the stent and other primary care during the attack. Some procedures are done, so the cost of the medication and cost of the procedures is so high that even the poor person is unable. It is a good thing that send the Institute of Cardiovascular Diseases as well as the National Institute of Cardiovascular Diseases, they are compensating, and their satellite and peripheral centers are there. The laboratory charges are also very high, and the poor patients are not able to pay the high cost. Particularly, the tests are written by the doctors in a great number, 6 7 tests to diagnose the disease, and ultimately these tests are either normal or they are borderline, and they are not helping in the diagnosis of the patient. So, with this, I think the nutritional diseases, non communicable diseases, lifestyle diseases, they are not discussed with the patient, or the doctors are not giving them proper time. So, ultimately, the prevention of the diseases is neglected, and the long care and costly care and multiple diseases, they force the doctors to visit one doctor, another doctor, then other doctor. So 4 5 doctors, if they can consult and provide at a one point a clear cut guidance to the patient, I think that is not Here in Pakistan, practiced every doctor just sends the patient to another system or to another consultant, and this separated or isolated health care is not giving the good results. So we need not only the integrated, but I think a well coordinated health delivery system or the healthcare providers must consider, particularly Pakistan Medical Association, Pakistan Dental Medical and Dental Council, and even the Pakistan Medical Research Council. They are not on the same page. The body of the doctors, PMA, is not in a favor of the bureaucratic system on which these regulatory bodies are run in Pakistan. It was initially a representation of the doctors, and elections were held for the Pakistan Medical Dental Council, but now it is a nominated and a bureaucratic system in the Pakistan Medical Dental Council. Same is true for the Pakistan Medical Research, and the same is, but in Pakistan Medical Association, the headquarter is in Karachi and its branches are in the provinces. So I think they must guide the general practitioner who are providing 80% of the health care in the rural as well as in urban area to help the people to maintain their health, and they should focus on the prevention of the diseases rather than cure and medication of the diseases. And even emergency care and the care where the ambulance services are required, or in the case of disaster, the healthcare system response is just they are opening the doors, but they have no such outreach programs. In recent, the Karachi fires in the plazas where thousands of the houses and families and children they are residing and they are losing their life due to fire and other disasters or collapse of the building. So this kind of disaster management skill or approach in the hospitals is not up to the mark, and the same is true when there is a heat wave or there is an epidemic. Now we are facing superflu, we are facing the Nipah virus danger, as well as we have already COVID cases reported somewhere, and though they are under control. And same is true that even the dog bite, one of the case in the Karachi, a child traveled from Chaman, which is away from Quetta, to Karachi in a full-blown rabies situation. So ultimately, this was the third case which lost the life, and the life-saving drugs and the vaccines, and same is true for the snake bite. And the rural area doctors, healthcare workers, they need a full refreshing as well as a community and prevention and universal health.